Did you know that a tiny glitch in a single gene can rob a child of their ability to walk, fight off simple infections, and even survive into adulthood, all while increasing their cancer risk by up to 1,000 times? Ataxia Telangiectasia, or AT, strikes about 1 in 40,000 to 100,000 newborns worldwide, turning what should be playful childhood years into a battle against a relentless, progressive disorder. It's heartbreaking to imagine a toddler stumbling more each day, not from clumsiness, but from their body's own betrayal. If you've ever wondered how this rare condition unfolds and what cutting-edge science is doing to fight back, stay with me. In this video, we'll explore the causes, the subtle yet devastating symptoms, how doctors catch it early, and the exciting advances in treatment that are offering new hope, even as we speak in 2025. By the end, you'll have practical takeaways to protect your loved ones or support those affected. Let's dive in, because knowledge here isn't just power, it's a lifeline. Ataxia Telangiectasia is a rare, inherited neurodegenerative disorder that primarily affects children, combining problems with movement, the immune system, and DNA repair, leading to early disability and shortened lifespans. Often diagnosed in early childhood, it progresses steadily, with most not living past their 20s or 30s due to infections, respiratory failure, or cancer. This isn't just a medical term. It's a thief that steals mobility, independence, and time from families. Globally, it impacts all ethnic groups equally, but its rarity means many go undiagnosed until symptoms snowball. I think of little Emily, a spirited 5-year-old whose parents first noticed her wobbly steps during a family picnic. What they dismissed as growing pains turned out to be AT's early grip, forever changing their world. Stories like hers underscore the urgency. Early understanding can ease the journey, even if a full cure remains on the horizon. Now let's break down what sparks this condition in the first place. The root cause of AT lies in mutations of the ATM gene, located on chromosome 11, which follows an autosomal recessive inheritance pattern, meaning both parents must carry the faulty gene, often without symptoms themselves. The ATM protein acts like a vigilant guardian, detecting DNA damage from everyday stresses like radiation or oxidation and triggering repairs to keep cells healthy. When mutated, this repair system fails, leading to unstable cells that die off prematurely, especially in the brain's cerebellum, immune cells, and blood vessels. It's like a city's infrastructure crumbling because the maintenance crew is absent. Small breaks turn into widespread chaos. Over 600 mutations have been identified, with some founder variants common in specific populations, like certain Jewish or Amish communities, making genetic counseling vital for at-risk families. But here's the thing. While it's genetic and not preventable through lifestyle, understanding your family history can empower proactive steps. This genetic breakdown sets the stage for symptoms that often sneak up quietly before escalating. Symptoms typically emerge between ages 1 and 4, starting with progressive ataxia, unsteady walking, and poor balance that worsens over time, eventually confining most to wheelchairs by adolescence. Imagine trying to navigate a room where the floor feels like shifting sand. That's the daily reality as cerebellar cells degenerate. Next, those telltale telangiectasias appear, small, red, spider-like veins on the whites of the eyes, ears, or cheeks, usually by age 5 or 6, signaling fragile blood vessels FC4AD4. They're not just cosmetic, they hint at deeper vascular issues. Immunodeficiency hits hard too, affecting 60–80% of cases, leading to frequent sinus and lung infections that can turn deadly without intervention. Emily's family dealt with endless colds that landed her in the hospital repeatedly, a common red flag. Then there's the heightened cancer risk. Up to 25–30% develop leukemia or lymphoma young, with solid tumors later due to faulty DNA repair, making cells prone to mutations. HO2EC5. Other signs include slurred speech, difficulty swallowing, increasing choking risks, tremors, delayed growth, diabetes, and even premature graying or sensitivity to X-rays. Trust me, number 5 might surprise you. Cognitive challenges aren't always severe, but combined with movement issues, they can isolate kids socially. If these sound familiar, don't brush them off. The next step is crucial for confirmation. Diagnosing AT involves a mix of clinical observation and targeted tests, often starting when ataxia and telangiectasias raise suspicions. Doctors look for elevated aggregated alpha-fetoprotein, AFP levels in blood, over 10 ml in most cases, a reliable marker after infancy. Genetic testing confirms it by identifying biallelic ATM mutations through single gene or multi-gene panels, or even exome sequencing for tricky cases. Brain MRI often reveals cerebellar atrophy, like a shrinking control center, while immune tests show low antibody levels or T-cell issues. Newborn screening for severe combined immunodeficiency, SCID, catches about half of cases early via low TREC counts, a game changer for timely care. Family history plays a role too, and prenatal testing is available for known carriers. It's not always straightforward. Milder variants might mimic other disorders like cerebral palsy, but getting it right opens doors to management. Speaking of which, while there's no cure yet, advances are accelerating hope. The good news is that treatments are evolving from purely supportive to targeted therapies, with 2025 shaping up as a landmark year for research. Traditionally, care focuses on symptoms, physical and occupational therapy to maintain mobility and flexibility, speech therapy for communication and swallowing, and immunoglobulin infusions to boost immunity against infections. High-dose vitamins, antioxidants, and prophylactic antibiotics help, while cancer surveillance, annual checks without radiation-based imaging, catches issues early. D94B6F. But here's the exciting part. Eridex, an innovative system delivering dexamethasone inside red blood cells, gained FDA fast-track status in 2024 and showed reduced neurological symptoms in Phase 3 trials, with long-term safety data published in 2025 confirming its promise for slowing ataxia. Nicotinamide riboside supplements are in trials, improving ataxia scores and immune function. Gene therapy with antisense oligonucleotides is underway, aiming to correct ATM defects without toxicity, and bone marrow transplants have restored immune cells in some, potentially halting progression. N-acetyl-DL-leucine is emerging for symptom relief, and hematopoietic stem cell transplants show mixed but hopeful results. For Emily, joining a clinical trial for Eridex brought noticeable stability. Stories like hers inspire us to stay informed. You can start by discussing genetic testing with your doctor if there's family history, or exploring support groups for emotional backing. While AT remains challenging, the horizon is brighter with options like Eridex and gene therapies in active development. Simple habits count. Encourage a nutrient-rich diet to support overall health, regular checkups to monitor AFP or immunity, and avoiding unnecessary X-rays. I actually remind my own family to prioritize preventive screenings. It's a small step with big impact. Consult specialists for personalized plans and consider clinical trials via sites like clinicaltrials.gov for cutting-edge access. Remember, progress is about persistence. Many families find strength in communities like the AT Children's Project. You're equipped now to advocate effectively. So, we've journeyed through AT's genetic causes, its creeping symptoms like ataxia and infections, the diagnostic tools from AFP tests to genetics, and those thrilling advances like Eridex and gene therapy that are rewriting possibilities. If any of this resonates, perhaps a child's unsteady gait or recurrent illnesses, don't delay. See a neurologist or geneticist for evaluation. Early action can transform outcomes, giving more precious time. Drop a comment below. Has AT touched your life, or which advance excites you most? Like if this empowered you, and subscribe for more insightful health videos that demystify the complex. Thanks for watching. Stay vigilant, stay hopeful.